friends. In this video, we will learn about stomatitis. Oral cavity consists of lips, gums, tongue, salivary gland, and teeth. So this is how healthy oral mucosa will appear with papilla on tongue surface, and this is how gums will appear, and this is how under surface of tongue will appear. Stomatitis is inflammation of mucosal lining of the mouth, which may involve cheeks, gum, tongue, lip, and floor and roof of mouth. The word stomatitis literally means inflammation of the mouth. Signs and symptoms are pain and discomfort in mouth, presence of open sores or ulcers, fever sometimes as high as 101 to 104 Fahrenheit, irritability and restlessness, blisters in mouth, swollen gums, which may be irritated and may bleed, and drooling and dysphagia and foul smelling breath. So causes include nutritional deficiencies, poor dental hygiene, radio and chemotherapy, traumas, smoking, trauma from dentures or tooth biting or lip biting, and dehydration, medication, and burns also cause stomatitis. So nutritional, angular stomatitis, denture, allergy related, and herpetic gingivostomatitis. So this is herpetic gingivostomatitis, and this is after ulcer due to stress, and this is nutritional stomatitis due to B12 deficiency. This is localized denture related stomatitis, and this is angular stomatitis, and this is nutritional stomatitis before and after treatment with B12. Bullous stomatitis in case of pemphigus. This is fungal stomatitis, oral thrush, and this is hairy leukoplakia due to HIV infections, and this is submucosal fibrosis, and this is advanced case of submucosal fibrosis. Management of stomatitis, medical management, topical anesthetics, and antiseptic mouthwash, avoid excessive brushing, and dental hygiene measures. Pain control, suck on ice chips or ice pops, use pain medication as advised. Dietary, eat soft food, avoid food that require a lot of chewing, avoid acidic, spicy, salt, and hot foods, and rinse the mouth 5 to 6 times a day. Brush teeth with a soft toothbrush. Angular stomatitis, symptoms of angular cheilitis will almost exclusively appear at the corner of the mouth, both physically painful and cosmetically frustrating. Corners of mouth may be bleed, red, swollen, cracked. Other symptoms include bad taste and burning, or lips feeling dry, difficulty in eating because of irritation. Fairly mild case of angular cheilitis extending to facial skin in young person. Affected area is within the black oval region. Angular cheilitis, a fissure running in the corner of the mouth. Cause is multifactorial. Source in the angular cheilitis often infected with fungal yeast and bacteria. Some studies have linked the initial onset of angular cheilitis with a nutritional deficiency, especially B2 riboflavin and iron deficiency anemia, which in turn may be evidence in case of malnutrition or malabsorption. Is also manifestation of stomatitis, angular stomatitis, manifestation of contact dermatitis, which is irrational and allergic types. Causes as discussed, the involved organism in infection, Candida albicans, bacterial Staphylococcus aureus, beta hemolytic streptococci. These types of bacteria have been detected in 8 to 15% of cases. Combination of above organism, a polymicrobial infection with about 60% of cases. Irritation with contact. Due to irritant, saliva containing digestive enzymes will cause this. The corner of mouth is normally exposed to saliva more than any part of the lips. Nutritional deficiencies, 25% with angular cheilitis, iron deficiency, and B deficiency of vitamin B. So, any case of stomatitis, we can do that B complex vitamin analysis and iron analysis, hemoglobin percentage and iron analysis. Systemic disorders can include some systemic disorders are involved in angular cheilitis by association with malabsorption, anorexia nervosa, orofacial granulomatosis, xerostomia, Jordan syndrome, inflammatory disease like Crohn's and ulcerative colitis. Several drugs also associated with xerostomia include isotretinoin and sorafenib and indinavir, and isotretinoin, analog of vitamin A, is a medication which dries the skin. Recreational drugs like cocaine, amphetamine, and heroin also cause these. Allergic contact dermatitis, examples include lipstick, toothpaste, acne products, and chewing gum, mouthwash, foods, dental appliances, dentures, mercury containing amalgam fittings, and a loss of lower facial height will also cause angular cheilitis, facial laxity. Diagnosis is clinically, if need, we can do this blood investigations for blood count at iron, ferritin, and B12 levels, and folate levels, and glucose level. What is the how is it is treated? Same treatment, antiseptics, topical steroid, ointment, and filler injections. And nutritional deficiency is there if you have to give nutrition supplements. And if yeast is present, topical antifungals and topical antibiotics will be used if bacterial infection is present. This is how normal gum mucosa on tooth will appear, where there is a inflammation of the gums we call as gingivitis. In moderate and advanced disease, there will be receding of gums with bone loss will be seen. Dental plaque induced gingival disease caused by plaque, systemic factors, medication, and malnutrition. Non-plaque induced gingivitis can be caused by specific bacteria, virus, or fungus. It might also be caused by genetic and systemic conditions. Causes accumulation of bacterial plaque, some diseases like diabetes, HIV, drugs, smoking, ages, and poor diet and family history. Symptoms swollen or puffy gums, and dusky red or dark red gums, and gums that bleed easily, halitosis, receding gums, and tender gums. Prevention or management, good oral hygiene and good health practices, brush twice daily, and stop smoking, and use a toothpaste like Crest to promote health, rinse thoroughly. Complications abscess periodontitis can lead to loss of teeth and recurrent gingivitis and ulceration of the gums we can see. Next is glossitis refers to inflammation of the tongue, which cause the change in size, shape, color, or taste or movement. Acute glossitis characterized by swollen papillae occurs and chronic gastritis, chronic inflammation not of substance of tongue but of mucosa covering the organ. So this is normal tongue and this is ulcerative glossitis where the ulcers are seen. And this is herpes glossitis where the vesicles. This is candida whitish mycotic lesions. And this is for folded glossitis. And this is desquamative glossitis. This is atrophic glossitis. And this is median rhomboid glossitis. Cause of glossitis, primary cause bacterial viral infection, mechanical irritation from dentures, tobacco, hard food, alcohol, burns, allergy to toothpaste or mouthwash. Secondary cause iron deficiency, vitamin B12, B deficiency, and pernicious, syphilis, ulcer, and HIV and tuberculosis. Symptoms are tongue swelling, difficulty in talking, swallowing, taste chewing, pain, fatigue, weight loss, and sore throat. Diagnosis history examination, blood examination, and oral swab. Treatment good oral hygiene, steroids will reduce the inflammation, and oral suspension of prednisolone may be used in case of mild cases. Antibiotic, antifungal, proper nutrition, avoidance of irritants. This is erythema, this is lichen planus, this is chronic inflammatory and immune-mediated release. This is leukoplakia, where white raised patches that do not come off when we rub them, and geographic tongue, red patches that have a white border. Geographic tongue. Lichen planus about 1 to 2% of usually adults more than 45 years. Oral lichen planus present in the following form: reticular form or ulcerative form. Reticular is symmetrical white lace-like pattern on buccal mucosa. In the aspect, there may be no signs or discomfort. Atrophic or erosive. Red lesions appear with a whitish border, which may cause erosion, superficial ulceration. Most often affects the gums and lips. Can be very painful. Ulcerative form. This is fibrotic form. White patches on the tongue. How is diagnosis is made? Mostly clinical only. Biopsy is helpful if there is suspicion of cancer. Under microscope, the pathologist may observe characteristic like noid reaction. Erosive form and ulceration form may lead to oral cancer. Treatment is same with proper dental hygiene with local anesthetic and topical steroid like triamcinolone buccal paste we can use and systemic immunosuppressive agents like hydroxychloroquine, azathioprine can be used. So treatment summary of this summary is red magenta dye. We give B complex supplementation, white deep abrilated tongue, oral iron preparation, oral thrush if there is oral thrush, clotrimazole oral paint, and give fluconazole 150 mg tablet stand, and submucosal fibrosis is there, refer to ENT, non-recurrent causes of ulcer, treat the cause. So oral cancer risk features are what could it look like? Red or red white patches, ulcers, unexplained ulcer lasting for more than 3 weeks, lumps, persistent or unexplained lumps on the lips, in the mouth, or in the neck, where in the lining of the cheek and behind the molar teeth and side surface of the tongue and floor of the mouth. Urgent referral. Examples of oral cancer: erythroleukoplakia, ulcerative, nodular, and ulceroprotective. Common referred benign lesions are frictional keratosis, lichen planus, and oral mucosa. Risk behaviors: tobacco use, alcohol, and betel nut usage. So, for example, this is oral mucosal fibro, oral lichen planus. We give triamcinolone 0.1% ointment. This is infected gum because of cavity tooth, which causes lip swelling. We give antibiotic for initial management, followed by removal of the infected tooth. This is ulcer in the angle of the mouth, which may lead cancer. So we can do the biopsy. For biopsy, we have to refer. Next, pain, tenderness, and fever since 1 day and below the ear lobule. It is warm at touch and tenderness also there, and patient complaints of weakness. So this it has a, if there is no source of dental infection like periodontitis, this can be a viral infection like mumps. We can treat with supportive management for 7 days, and we can follow. And here in the floor of the mouth, there is ulcer. There is not ulcer. Floor of the mouth, there is congestion, which along with lymphadenopathy. So there is also no tooth infections noted. So we can take anti-opinion along with antibiotic and chlorhexidine mouthwash until it resolves.